About 28% of Australians live outside of metropolitan cities. The remoteness of many regional and rural towns means there are extra challenges to providing services for residents. And out here, there are concerns about a growing bidding war for one of the most critical service providers, doctors.
My name's Alice. I'm a GP registrar and I've basically done most of my training as a doctor rurally and love it.
Dr. Alice Callaghan prefers country living. She jumped onto regional training programs when opportunities popped up in WA's Great Southern and says she's unlikely to ever go back to living in the city.
I think overall I think it's the pace of life. It's just a bit more relaxed. People get to know you and you feel like you're more part of something than you do in the city.
But it's not always this easy to bring doctors out to the country. Across Australia, it's estimated we're about 2,400 full-time equivalent GPs short of meeting demand. The Department of Health projects that shortfall will increase to about 3,900 by 2028 and 8,900 by 2048. Rural, regional and remote towns are most likely to be impacted by that shortfall. So some of these country towns, like in Western Australia, have been offering huge incentives to attract doctors, like the Shire of Quairading in WA's Wheatbelt.
I think that's perhaps more perception than anything else, that it doesn't offer what a big city like Perth or a big regional city has to offer. It was a challenging process after our previous doctor completed his time here because we obviously needed to attract someone to our town.
The huge salary package the Shire offered made national headlines.
Small WA town offering $1 million salary in
the $1 million job no one
Town
wants.
of Quairading offers $1 million to doctor willing to move in.
$1 million salary sounds more dramatic, perhaps, than the reality. In a nutshell, the Shire subsidises the management of the practice to the tune of $400,000 a year, plus the 3 residences for him and his staff. He takes home the full billing.
$400,000 and 3 homes, that's a lot of money. Is it worth it?
He's providing a top quality primary health service. Perhaps I would reframe the question is, could we afford not to have that service? And the answer is no, we couldn't afford not to.
And what about the shires that can't afford to pay this much?
That's putting them in a really tough situation, because there's an argument for saying that we're struggling to afford it, but we put it as a very high priority. There's probably shires who, even though it's a very high priority, simply can't do it. As country shires, we work together very well. But when you're putting us, well, when we're being put in a position where it's perceived as a bidding war, you're pitting one town against another, which is not healthy.
The Federal Health Minister, Mark Butler, says there are more GPs in training than ever in Australia's history.
We're working hard too to put in place incentives to see more doctors work in the bush. But this is something we focus on and monitor very closely, and we're determined to work with state governments, with local councils and with GP groups to fill those gaps where they emerge.
Alice drives about 40 minutes each morning to work in Mount Barker, a town with about 3,000 people.
I think most doctors aren't purely doing it to earn a lot of money. You do it because you want to make a difference.
She receives an extra $4,800 a quarter from the Australian government for being a regional registrar. But she says bringing her city colleagues out to the country isn't as simple as stumping up a bigger paycheck.
Historically, you know, a lot of these classic country doctors who would do everything, they would be on call 24/7. Doctors coming through training now have a lot stronger emphasis on, you know, work-life balance, not burning out. It's tricky because it's hard enough to attract people to small towns anyway, but if you were to work in a place like this, and rather than getting just paid like a truckload of money, have a system for if you need to take leave, there's someone that can look after your patients for you. Your results are awesome. It tells you here, like, if your sugars are above 15.
My last medical episode, I was really sick. Made it to Mount Barker Hospital and they transferred me via ambulance to Albany Hospital, and it was made so easy.
The thumb is weak as well. Can you just raise my hand?
But when we were in the Midwest, they had no doctor. It was so hard.
It would be ideal to have funding so that these towns who don't have the income and can't attract a doctor would be able to still do so.
I'm not in a position to announce policy now. More doctors is a really important element of our strengthening Medicare agenda, and it's particularly important in rural and regional and especially remote Australia, where it's always been harder to attract doctors and other health professionals.
Being a rural GP, we have to do quite a few extra things.
Dr. Laurie Hopkins has worked as a GP in Albany for decades. She says the lack of specialists in the country means general practitioners often need a broader skill set than their city counterparts.
You can't get appointments sometimes because there's not enough doctors. Well, our nurses can bring them in, do an initial assessment, just like a little hospital ED.
Laurie has spent more than a decade with the University of Western Australia's Rural Clinical School. She says it's easier to attract doctors to country towns if they already study and live in the country.
I think the fear of not being able to get training is one thing that stops people going to those areas.
But a growing and ageing population means demand for healthcare, especially in regional and remote towns, is outpacing supply.
The people who live there often have a high degree of medical acuity because they can't attend and get preventative medical care. So funding into training and funding into supporting the community to help source GPs and nurses are really important.
That would free up funds in our instance, and in the instance of other shires who perhaps can't find the sort of money required to recruit doctors, it may give them the opportunity to do so. So in both situations, it would be massive benefit.
It's a basic need to have healthcare. The way that our system is set up, Medicare is for everyone. It would be really in line with those values for the government to support towns who can't attract a doctor to do so.